MCQ discussion on statistics and epidemiology for Final MBBS students. Even though in Final MBBS we are testing clinical related things, there are 1 or 2 MCQs in the exam paper. So that MCQ will be the MCQ decide your rank. That may be the MCQ decide whether you pass or fail, whether you are getting class or not, whether you are getting the internship in your preferred station or not. That may be the MCQ, whether you are getting your preferred appointment during the internship or not. That may be the MCQ decides whether you are getting the post-intern appointment in the place you need. I know that some of the students are forgetting this specific part and focus on the other MCQs. But this MCQ discussion will help you to have some understanding. During this MCQ discussion, I will discuss some of the questions that I received from the students. So these MCQs may not be the direct MCQs that you have seen in the exams, but these are the MCQs that I got from the students. So there might be differences of wording. So first we will discuss the MCQs appeared in medicine paper. A randomized controlled trial showed that drug X is superior to placebo for lung cancer. What is the best indicator that showing the efficacy of drug? 5 options: number needed to treat, relative risk, odds ratio, p-value, and standard deviation. I will start from the bottom. So what is standard deviation? Standard deviation is a measure of dispersion. We are going to measure the dispersion. So this answer is out. P-value, you can determine whether there's a difference between p-value or not. What about odds ratio and relative risk? Based on your study design, there might be help using relative risk where you can compare the incidence. So the odds ratio, of course, based on your design, you can again apply the odds ratio as well. But mainly, relative risk and odds ratio, we generally use them to determine the risk factors. So these 2 answers are out. So the next 2, p-value and number needed to treat. Keep in mind, number needed to treat is a special concept that we apply specifically in clinical trials. So let's consider what is number needed to treat. Assume that now we are comparing drug and placebo. In this lung cancer, generally with placebo, 8 out of 100 people are dying when we are treating with placebo. So other 92 will die in subsequent time. Assume that this is within 1 month period. With drug, after you apply drugs, you reduce that to 4 out of 100 within 1 month period. Now you have improved mortality from 8 per 100 to 4 per 100 by applying this drug in comparison to placebo. Keep in mind, this is an example. So what is number needed to treat? Number needed to treat is a concept applied to describe, in order to survive one, how many patients that we must treat. So in the same example, now we know that 8 per 100 versus 4 per 100. This means we can survive 4 individuals when you are treating 400 individuals. So, in order to survive 1 individual, how many patients that you need to treat? So, in order to survive 4 patients, you need to treat 400 individuals. So, for 1 individual, how many of them that you need to treat? So, this 4 came from 8 minus 4 because the extra survival is for 4 patients. So, this equals 25. So you can easily understand that in order to survive 1, you need to treat for 25 individuals. So let's go back to the MCQ. So in this MCQ, what we are remaining is number needed to treat and p-value. Of course, we are interested in p-value, which is kind of correct answer, but number needed to treat is more appropriate in this circumstance. Why number needed to treat is more appropriate than p-value in this circumstance? The reason is, even though p-value is significant, that means p-value says statistical significance. That means whether it is statistically significant or not. Number needed to treat says how many of them that you need to treat in order to survive 1. There might be situations where there's a statistical significant association, but in order to survive just 1 individual, you may need to treat 100,000 individuals or 1 million people. In that case, that drug may not be effective when we are treating a disease like cancer, so where we don't have much patients in the community. Okay, we will go to the next MCQ. Few-test screening for breast cancer done on 100 females whose age is 45 years, and 15 females were positive for breast cancer, and out of them 12 females were given positive results for the test. 5 females who hasn't had cancer were also positive for the test. What is the sensitivity and specificity of this test? This is very simple MCQ where you need to have the ability of plotting the 2 by 2 table. So let's quickly discuss how to plot this thing. So read these statements carefully. Now, this is the 2 by 2 table where the total number tested, that is 100, and here we have gold standard test positives and negatives. Here we have screening test positives and negatives. Here we are testing for breast cancer. Now the total 15 breast cancer patients are there, so because of that we need to know that the rest is 85. Out of 15, the screening test detected 12 patients, and because of that screening test has not correctly diagnosed 3 patients, and out of 85 breast cancer negative patients, the screening test was positive for 5 people, and rest 80 is correctly diagnosed as negative. So here the total is 17, and here the total is 83. So you can say 17 plus 83, it is 100. So now you are okay. The question is very simple. What is sensitivity? What is specificity? What is sensitivity? Sensitivity is ability of screening test to identify positives or the diseased people as diseased. So that is, you can easily do that thing. So the sensitivity is out of 15 patients, 12 diagnosed correctly. So this is into 100. That is, sensitivity is this equals 80%. So we have 2 answers here. This one and this one. So all the others answers out. So what is specificity? Specificity is out of 85 patients, how many of them have identified as negatives? So out of 85, 8 diagnosed as negatives. So as a percentage, it is around 94.1%. So here the answer is wrong. So the answer is this one. Will you get this kind of question in the exam? No. So there might be similar kind of questions, but there may be questions asking what is positive predictive value, what is the negative predictive value. In clinicals, rather than going for sensitivity and specificity, positive and negative predictive values are more important. The practical applicability of these tests, these kind of questions can be there. So if you need more details, you can go and watch my lectures on sensitivity, specificity, positive and negative predictive value lectures. I have done a series of lectures. So let's go to the next MCQ. Again, simple MCQ. The distribution of serum levels of alpha tocopherol or serum vitamin E in a certain population is approximately normal with a mean 800 micrograms per deciliter and standard deviation of 200. The approximate reference range within 95% of the healthy population lies is here. They are testing your knowledge on normal distribution, which is very simple. Let's see how can we apply the normal distribution knowledge in this MCQ. Here we have a normal distribution where the mean is 800, 1 SD, 2 SD, minus 1 SD, 2 SD. So standard deviation is 200. So here it should be 1000, and here it should be 1200, and here it should be minus 2 SD, here it should be 400. As we are interested in 95%, the 95% is actually it is mean plus or minus 1.96 SD. So we can discuss more on these things, but here the answer is 400 to 1200 where the 95% is there. But actually, in the exam, there might be similar kind of questions in different aspects. There might be a question, the proportion of individuals more than 1200, or the proportion of individuals in between 600 and 1000. So like that, there can be several aspects that we can test your medicine knowledge by application of normal distribution concept. So let's go to the next MCQ. So the next MCQ is, which of the following best indicates confidence interval? This is one of the most important MCQ and one of the most important application in medicine. So that is confidence interval. So let's see what are the applications of this specific question. Confidence interval is one of the most misinterpreted concept even by some of the statisticians. If you need more details, please go and watch my lectures on confidence interval. I will briefly discuss here what is confidence interval. Okay, we will start with distribution of height of the individuals. Okay, so we can do something like this and assume that this is the population distribution where the mean height is there, something like assume it's 160 centimeters, and in this end you will have the individual with the lowest height and this end the individual or the tallest individual. This is the population distribution. There's nothing to do with this population distribution. Confidence interval is something related to sampling distribution. What is sample distribution? We are taking multiple samples from this population distribution and we calculate the mean. We will name that x bar 1, so x bar 2, x bar 3, so like that till n number of samples x bar n. You can plot this n number of sample means in another distribution which will take the shape of normal distribution. We call that sampling distribution. Why? If all these samples are random and representative samples, if this is the population mean, where we name that as mu, you take random samples, so that must be more closer value to mu. So that may be something x bar 1. And if you take another one, that may be another something like this. So if you take another one, maybe slightly higher than this one. So like that, those sample means will be plotted either side of the population mean. So which will ultimately create another normal distribution. This is sampling distribution and again confidence interval is something else. Now in practical situation, we don't take multiple samples. We are taking just one sample, and if you can recall, by taking you will have the sample mean which is x bar, and by using the sample size you will create something called standard error. Based on standard error, you guess what is sampling distribution. If you need more details, please go and watch my video on confidence interval in my lecture series of statistics for non-statisticians. And the sample, the single sample that we have taken, so it is x bar plus or minus 2 standard errors is what is called confidence interval. So this x bar is one of the x bars in the sampling distribution. This can be either this one, this one, this one, this one, or something in this area. So this x bar can be 1 x bars out of the 100% of the x bars within the sampling distribution. But if, as we have drawn the sampling distribution curve, we know that on 2.5% of the sample means will be more than 2SD area and 2% of the sample means will be in less than 2SD area. So in our x bar can be any of this. Now confidence interval says that this x bar can be 1 out of all these x bars. If we take as a percentage, there's 95% probability that this x bar can be in the null region or in the central region of the sampling distribution. So if and standard error is the standard deviation of this sampling distribution. So when we take x bar plus or minus 2 standard errors, we are telling that there's 95% probability that this x bar to be a x bar in this central region. Because of that, this x bar has 95% probability to capture the true mean, but still there's 5% probability to become this x bar either in more than 2SD area or less than 2SD area. So there's 5% probability that this will not capture the true mean. Confidence interval says that because of this property, we can interpret that there's 95% probability that this X bar will capture the population mean. Because of that, the answer for this question is this one. There's 95% chance that the population mean will fall within the confidence interval. Of course, there are problems with the stems because these are the MCQs given by the students to me. So because this chance is not a good word in this particular MCQ. We are telling that it's 95% probability that the population mean will be there. But even there are problems with this statement. But what I describe here is the correct way of describing the confidence interval. So like that you will get questions related to p-value. Here basically they are testing the knowledge on the statistical applications. There might be questions on confidence interval for proportions, confidence interval or about p-value, so like that. So there may be several other types of questions. Not only in medicine, you will get questions in gyn and obs as well. The question is, in a province A, for the year 2013, the following statistics were recorded. There are certain number of statistics and you are asked to calculate the perinatal mortality rate for this province for the year 2013. It's very simple one. If you have gone through your demography lecture notes, you can easily get the answer for this one. But there's a tricky point. So what is perinatal mortality rate? Perinatal mortality rate is a rate in the numerator. We have the total number of stillbirths plus early neonatal deaths. So you know what is stillbirths, early neonatal deaths before completion of day 6 or before 7 days. And the tricky point is, what is the denominator? Some people say that total number of live births has the denominator. But keep in mind, in the denominator, in perinatal mortality rate, the denominator is total number of live births plus stillbirths. According to this MCQ, so this should be, so you can easily understand that 300 divided by 10,000. Usually we tell this perinatal mortality rate per 1,000. So the answer will be, so the answer here is 30. But some may think that we can use only live births in the denominator, which is 9,000, which is 9,800 here. But the answer is wrong. If you apply 9,800, that will not be a rate, that will be a proportion. So the answer is 30. We'll go for the next MCQ. In very simple MCQ, in a province, the total number of live births was 10,000 and there was one maternal death due to postpartum hemorrhage. What is the maternal mortality ratio for that province? It's very simple mathematical thing. We know that what is maternal mortality ratio. Number of maternal deaths divided by the number of live births during a certain period. So here we know that total number of births was 10,000 and maternal deaths were 1. So 1 divided by 10,000. In Sri Lanka, we are telling the maternal mortality ratio for 100,000. So the answer is 10 per 100,000. But if you look carefully, 0.01% is correct. 0.1 per 1,000 live birth, it is still correct. 1 per 10,000 live birth, still correct. 100 per 1 million live births, all are correct. But this is the most correct one in Sri Lankan setting. But if you go to in some African countries, even though we are telling per 100,000, there's no rule, such rule in demography where the maternal mortality is high. Even you can present per 1,000 or per 10,000, so like that. This is very simple MCQ. This MCQ will not come again for the exam. So you maybe need to know what is infant mortality rate, infant mortality ratio, maternal mortality rate, all the other indices related to demography. So next MCQ. It's again very simple MCQ. There's screening test going on. So here they have the screening test positive or negative. They have the gold standard test positive or actually whether they are having the disease in columns. The 2x2 table given below shows the results of new tests to identify chlamydia. What is the sensitivity? Easily you can understand the sensitivity here as I discussed previously. Out of total number of diseased people, how many of them have identified by the test correctly? So that is 10 divided by 15 into 100, which is 66.6%, or the answer is 67%. I have discussed some of the MCQs given by the students to me, but keep in mind these similar MCQs will not come for the exam. Please read around the topic. You will be easily answering this specific MCQ, which might be the MCQ decides on your future life. Thank you very much.